Hello, my name is Nick DiLiberto, and for my midterm mini-lecture, I'm going to be talking about 4 different questions, 3 being about the TED Talk about the problem with race-based medicine. Right now I'm going to summarize why Robert's experience of participating in a research study was troubling. She was in a research study, and one of the questions that she had to fill out was check the box of your race. She did not know how to answer this question of what race she was. She asked the question, was it aimed for participants' social backgrounds? What if the researchers were interested in investigating some association between ancestry and the risk of certain genetic traits? She had a white father with a black mother, and she ended up checking the black box, but she had no confidence in doing so. The next question I'm going to talk about is, what examples does Roberts give to illustrate how race shapes medical practice? Race shapes physicians' diagnoses, measurements, treatments, and prescriptions and diseases. She talked about the map of the human genome. When the map of the human genome was unveiled at the White House ceremony in June 2000, President Clinton declared a genetic terms human beings, regardless of race, more than 99.9% the same, and that 1% did not fall in racial boxes. Doctors take GFR and the results of the GFR are routinely interrupted by race. It's based on the assumption that African Americans have more muscle mass than other races. Race also blinds doctors to patients' symptoms, family illnesses, their history, their own illnesses, and their own illnesses they might have. She talked about a doctor called Dr. Cartwright's tool, which is called a speedometer, and the tool showed that people of color have lower lung capacity than white people. Next, I'm going to discuss what Roberts means when she says race-based medicine causes distractions from social determinants that cause appalling racial gaps in health. Some of the reasons that she lists are the lack of access to high-quality medical care, food deserts in poor neighborhoods, exposure to environmental toxins, high rates of incarceration, and experiencing the stress of racial discrimination. She goes on to say that race is not a biological category that naturally produces these health disparities because of genetic differences. Race is a social category that has staggering biological consequences, but health of the impact of social inequality on people's health. She also says that race medicine pretends the answer to these gaps in health can be found in race-specific pill. There's a pill that she talks about that doctors prescribe only to colored people of heart congestion, and she goes on to say that that is pretty ridiculous. So now I'm going to list 2 examples of articles that illustrate how stress associated with racial discrimination can cause adverse health outcomes. The first article that I found is from Matthew Klingel, and it is titled Inescapable Paradoxes, Diabetes Progresses, and Ecologies of Inequality. The 2 examples that I found that what he talks about is the Pima and how stress of not having enough nutritious foods in their diet that results in high rates of diabetes in their culture. The other example I found was the synergy of coexisting poverty, poor education, and pollution likely contributes to metabolic diseases like diabetes. The next article that I'm going to talk about is from Diana S. Lauderdale, and it talks about birth outcomes from Arabic named women in California before and after 9/11. Arabs experienced a period of harshment, violence, and discrimination in the workplace in the U.S. after September 11th, 2001. A study showed that after 9/11, pregnant women of Arab descent in California had elevated risks of their births, like preterm birth and low birth weight. That will conclude my mini lecture for my midterm.